Despite this rising awareness of mental health, Asian Americans have a lower utilization rate of about 25% of these services compared to their non-Asian counterparts, which is about 52%. In this research study, I will be focusing on the Asian American group of Cambodian Americans. For those who don't know, I'd like to go over who Cambodian Americans are. Cambodian Americans are individuals of Cambodian, also known as Khmer, ancestry. Cambodia is in the southeastern part of Asia, next to Vietnam, Laos, and Thailand. And many Cambodians came to the United States as refugees to escape Pol Pot and the Khmer Rouge, which we will be talking about in a couple of slides. The problem that we are addressing in this research study is the low mental health service utilization for Cambodian Americans, despite their rates of post-traumatic stress disorder and anxiety as high as 88% in some communities. The study aims to identify strategies to improve mental health services for the Cambodian American population. There will be a focus on the factors that contribute to or inhibit these mental health seeking behaviors for this population. And I also want to identify if healthcare insurance coverage plays a role in mental health service utilization. The study may advance the awareness of the Cambodian American community in the healthcare field, and the findings of the study may allow me to call attention to the barriers preventing Cambodian Americans from seeking care. The research question will be, what are the barriers to mental health services for first-generation Cambodian Americans? A review of literature unveiled a few common themes, which are mental health and post-traumatic stress disorder, being refugees, health beliefs, and access to healthcare, and how they affect Cambodian Americans from utilizing mental health services. I'll briefly discuss these key themes in the next few slides. The first theme was Cambodian American refugees. Cambodian refugees came to the United States at an early age, either alone or really young, with no formal information or no formal education. So the traumatic experiences of these Cambodian refugees during the Khmer Rouge and having to come over to the United States at an early age may play a factor in whether they know how or where to seek for help, such as healthcare services or mental health services. The next theme was trauma and PTSD. This theme emphasized the need for researchers to understand the trauma experienced by these survivors, because these experiences have been associated with negative physical and mental health outcomes. In a study by Orr, they explained that prior to arriving to the United States, Cambodian Americans reported having traumatic experiences such as torture, starvation, forced labor, or witnessing the murder of their family members or close friends. Another study done in 2023 found that untreated mental health illnesses such as PTSD, depression, anxiety, and other severe mental health conditions are present in Cambodian American refugees, especially the first generation. The third theme is culture and mental health stigma. A lot of studies, such as G et al. In 2020 and MAC 2023, found that a family stigma surrounding mental health can contribute to whether or not the individual knows or is accepting of the term mental health or utilizing these services. When you look at the number of mental health professionals who are Cambodian American, according to the Asian Mental Health Collective's U.S. Therapist Directory, there are only 14 Cambodian therapists, and the number of Cambodian American therapists is low compared to the other Asian counterparts, such as Chinese, who have about 422 people on this list, Filipinos, who have 139 therapists, and Koreans and Vietnamese, who have about 206 and 128 therapists listed on this directory. The final theme was knowledge and availability of mental health services. There was a common theme that showed lack of knowledge about mental disorders and beliefs about the mental disorders, as stated before. A lot of families, they have a negative thought, like outlook on mental health, so they don't promote their family members or themselves to go and seek help because they don't believe it's real, or they think it's karma, or they believe it's some other spiritual belief that's why that person is feeling that way, and it's not an actual disease or disorder. And another theme uncovered was the healthcare costs and coverage, which people did not feel comfortable seeking out healthcare coverage or healthcare because the lack of healthcare coverage or the cost of the coverage or the cost of the healthcare. The conceptual framework that I will be using for this research study is the healthcare access barrier model. This model was developed by Carrillo et al. In 2011. The framework for this study was used to understand the factors affecting access to healthcare. And Carrillo established 3 categories, either cognitive, structural, or financial. Other studies that have used this framework include Gigler 2020, who used it as a guide to examine the relationship between barriers to mental health care and self-reported mental health status. The research design selected for the study is a case study. A case study is basically a qualitative design where researchers are able to explore an event, process, or of one or more individuals. It will allow for us to gather data from several participants at one time and identify any themes or patterns. The sample population, or the population that I will be getting my sample from, will be from Cambodian Americans in the greater Columbus area, and they must meet the criteria of identifying as a Khmer descent, be 18 years or older. They must be considered first generation, which is arriving in the United States in 1975 or after. I will be sampling these individuals with convenience and snowball sampling. And there will be about 15 to 20 participants in the Central Ohio America. That's like the ideal number. Some guidelines suggest between 20 or 30, but I believe this sample size should be sufficient, judging from similar qualitative studies where the participants were also first generation immigrants, such as a study in 2020 done by Antu Tai, who had 11 respondents, and then another study in 2019 who had 9 respondents. Now, these interviews will be conducted via Zoom or another safe environment, such as the participant's home or the local temple, also known as the Wat. And that's a very long name, and I butcher it every time, so I'm not going to say it. I just call it the Wat. So for the data collection, I will begin the interviews by introducing myself and the interpreter if needed. Most first-generation Cambodian Americans, their first language is not English, so they may more than likely need an interpreter. So I will introduce the interpreter. I will ensure that they've signed the consent form and answer any questions that they may have before the interview begins. I will inform them that the interviews will be recorded, whether it be on Zoom recording or if it is in person, I will record it on my phone. So the interview type will be semi-structured interviews with 9 open-ended questions. The questions will fall under 4 categories, either background, health beliefs, mental health care seeking behaviors, and healthcare experiences. Once the interviews are finished, I will immediately upload the recording files to my computer, and then I will analyze the data immediately. I will work with the interpreter to transcribe these interviews using Otter AI, which is a common transcription program that's online, and it will transcribe the words and any sounds, verbal, nonverbal sounds for me. The only limitation with using Otter AI is its inability to translate from Cambodian to English. So I will rely on the interpreter to ensure that the transcriptions are correct. These recordings will be kept digitally on my computer, password protected, or if they are written, I will keep them in a locked cabinet in my home. For data security purposes, I will keep it for about 3 years. And then once the recordings are fully transcribed, I will use the Atlas AI for coding. So this program online will allow me to kind of find any relevant themes and see if there's any commonalities between the participants' responses. And then I will then use member checking to ensure that nothing was missed and that the transcript is correct by providing a copy of the transcript to the participants. And once the participant signs off on the transcripts, I will either delete the file if it was delivered digitally, or I will shred it if it was delivered in person on paper. And that was before the coding. I'm sorry, I mixed them up. After that, I will clean the data just to make sure there are no errors, no repeats, nothing was incomplete. And once the data is clean, I will be able to interpret the data. And this will allow me to see any disparities, commonalities between the responses. I do want to cover some limitations of the study. One being the translation from Cambodian to English. Oftentimes there are some words that might not be translated parallel to the English language. So I will try my best to get, with the interpreter's help, I will try to get the most accurate meaning of the participant's response. Another limitation might be the interpreter's presence. Some people might be not as open to talking about their experiences, like such a sensitive experience with a lot of people or a lot of strangers there. So that might be a limitation. And generalization might be another limitation, since I will be using snowball sampling and convenience sampling, and people will refer other people to my study. I can't use it to generalize over all of the Cambodian American population, just those in Central Ohio. So for my program learning outcome, I would hope to apply all of my findings to promote awareness for the Cambodian American population and possibly other minority groups by using the results as a guide for other groups that may be seeking assistance. And then, are there any questions? That's the end of my presentation.
All right, thank you, Melise. Very, very nice presentation. I'd like to start off the questions. First question I have for you, you stated in there you're going to use an interpreter. First of all, how will you select an interpreter? What would be the qualifications for these folks?
So, good question, thank you. I am aware that there is a network of certified or licensed healthcare interpreters. So I will be using one of the interpreters from that network. I'm unsure about how to go about that yet, but that is, to my knowledge, there is a network and I just need to figure out how to get there.
Okay, and also on the same lines with the interpreter, there's always a chance that someone could be ill, have a family issue. Do you have a backup interpreter in case they had to step in?
I did not think about that, but I will secure a backup as well.
Okay. All right, that's all the questions I have. Dr. DePryder, any questions from you, ma'am?
Yes. Thank you, Melise. That was lovely. You did a very nice job. It was very clear, easy to follow. You were very clear spoken. So thank you for that. All right. So I have just a couple of different areas, things that I jotted down as you were talking. In your methodology, and this also aligns with Leo's question about the person, I don't know why the word is slipping my mind right now. At any rate, so this to me seems like an extremely sensitive topic, right? And I'm curious to know your thoughts as you are envisioning yourself in the interview process with the participants. I suspect that there might be some very strong emotions that come about as they are talking to you. And I'm just curious to know how you will address that if the interview becomes extremely emotional, for example.
I know that this is a sensitive subject and a topic that people are not comfortable with, and I will always give the option to the participant if they want to stop or they need a break, or if they want to go to the next question, or if they're not comfortable answering, they do not have to. We can definitely conclude the interview if it's too hard. And then I will also like to provide some sort of resource for them as well, because I know these feelings can bring up a lot of emotion and maybe bring them back a lot of memories. So I do understand the risk there, but that is my plan, is to just offer them the option to just completely stop, so that way it doesn't get more difficult on their emotions.
Okay, thank you. And the word that I had forgotten was interpreter. So what I was going to ask about the interpreter is, so in your presentation, when you were talking about the interviews, you said that one limitation of having an interpreter present is that the participants might not feel open or comfortable in talking with, you referred to this person as a stranger in the room. Now, I'm curious to know, are you a stranger to these participants, or do you have some sort of existing relationship? And if you don't, then how confident are you that they would feel comfortable talking about these topics with you?
Good question. Thank you. I don't anticipate to have a relationship with these participants. I guess I was trying to say it's kind of overwhelming if you have to talk to multiple strangers about this experience versus like a one-on-one. So that's what I was getting at. I don't have pre-existing relationships with these people or with the participants, but neither with the interpreter. So I guess that's what I was kind of getting at was, it might be hard to let alone talk to one person and then talk to two people about it that you have no idea, they don't know who you are. So it can be kind of scary for them or a little overwhelming.
Yes, absolutely.
Yeah.
Thank you.
Thank you.
Then going to your literature review, I appreciate that you referred to a wide variety of sources when you were talking about the different themes that you found from the review of literature. And I am curious to know if you can maybe talk about 2 or 3 key pieces of literature that you felt were the most relevant to your study. So in other words, of all of the literature that you read, what were some of those pieces that you felt spoke mostly to your particular study?
Thank you for that question. That is a good question. While there weren't a ton of more recent literature on Cambodian Americans. There were some that were fairly recent. There was one by Pohl, Lim, and Slater. Their study was was similar to mine, but it definitely, they spoke on first and second generation Cambodians and just their healthcare seeking capabilities and, you know, their journey. So that really kind of resonated with me. And another one, I'll have to get back to you on the other two because there were a couple just going around, but there were some great pieces of literature that I did review.
Okay, off the top of your head, were there any that you really felt connected with in terms of the methodology, the methodological approach that was used in the literature?
Yeah, there was one by Tai in 2020, and the methodology, I did enjoy the way, well, I really did appreciate the way they did their methodology. It's very similar to the way that we have, or that I have this research study set up, just because it wasn't, the participants were immigrant participants and they were focused on like open-ended interviews as their, you know, their tool. So I did kind of mirror that a little bit. That was a good source for me to kind of reference back to.
Okay, excellent, thank you. And I have one last question that in this one will not be a challenge.
Okay.
When you were talking about the purpose of your study, so you said that you wanted to identify the factors that impact or perhaps prevent Cambodian Americans from seeking mental health treatment. And I would like to know what you foresee as a short-term goal or short-term outcome rather of your study. And then what would you like to see long-term? What's a goal of your study long-term once you've completed it?
Short term would definitely be just identifying like what are the reasons they aren't pursuing these services if they need them. Another, as I mentioned, was using these results as a guide for other minority groups if they are needing assistance, because I think it could be a good kind of just guide for other groups if they're having the same issues. And I believe that would be my long-term goal, was to kind of create some sort of system or program to kind of help them with that.
Mm-hmm. Very good. I appreciate your responses. Thank you.
Thank you.
Thank you, Dr. DePryder. Dr. Shepard.
Hello, yes, Melise, excellent job. Again, very clear, easy to follow, but of course, I do have some questions. Um, what would you say the biggest cultural issue is for Cambodians that prevents them from seeking mental health help?
I would say, based off of my readings
Mhm.
and my review, it would be just their beliefs, their health beliefs. They don't believe that, most don't believe that mental health is a real thing, that it's just kind of made up, or they don't believe in seeking help for things of that nature. So I believe that's probably one of the biggest cultural barriers that I would identify.
Okay. Okay. Second question. How do you plan to starkly mitigate biases to avoid a serious tilt in your research? Of course, you're a professional, you can be objective, but how do you plan to have a second layer of mitigating any type of tilt when someone's reading your work?
That is a very good question. And I can't think of the answer right away. I would just remain, you know, I wouldn't use any persuasive questions. They're open-ended questions. I wouldn't try to like sway the readers or the participant to answer a certain way. That would be my main driver, is just to be very professional and allow them to speak freely without kind of guiding the conversation.
Excellent. Excellent. And I kind of noticed you use some terms which I'm fine with, but would you like for your research to be able to be adapted internationally or domestically in the United States?
I say my first goal would be domestically,
Okay.
and then if that is successful, then eventually internationally would be great.
Okay. So if you want it to be done, used domestically, internationally, then terms like I would suggest using terms like Cambodian community. Okay, when you're speaking domestically, internationally, the term minority may not be the proper term to use because internationally and globally, um, it using the term minority may mean something different to different people.
Okay.
So like if people come from African descent, internationally, there's more of those people in the world. So that's just an example of what I'm saying. So if you want it to
Okay.
be domestically, then you want to say like the Cambodian community or use terms like, the Cambodian community in Ohio or something like that. So just be a little cognizant of that term minority and how you're using it. Just wanted to point that out. But I thought it was great. Good job. That's it.
Thank you. Thank you so much.